Welcome back to our series on substance use disorders. In this episode, we'll explore hallucinogens, inhalants, opioids, and sedatives. Each of these substances affects the brain in unique ways, but all can cause significant harm if misused. Let's start with hallucinogens. Classic examples include LSD, psilocybin, and mescaline. These are Schedule I drugs, acting primarily on serotonin receptors. Their effects can last up to 12 hours, and while they don't cause recognized withdrawal, tolerance builds quickly. Intoxication can involve vivid hallucinations, synesthesia, like hearing colors or seeing sounds, plus anxiety, paranoia, and even panic. Physically, users may have dilated pupils, sweating, tremors, and rapid heartbeat. Risks aren't just psychological. Hypertension, hyperthermia, and poor judgment can lead to serious injuries or even death. Treatment for a bad trip is usually supportive care, with benzodiazepines for anxiety and antipsychotics if psychosis develops. Some people also experience flashbacks, known as persisting perception disorder, long after the drug is gone. Now, inhalants. These include household products like solvents, glue, aerosol sprays, and fuels. They're most common among adolescents, with nearly 1 in 5 high school seniors reporting use. Inhalants are rapidly absorbed through the lungs, producing effects within minutes but lasting only a short time. Intoxication may cause dizziness, slurred speech, weakness, aggression, or euphoria. Severe cases can involve coma or sudden death from arrhythmias or asphyxiation. Long-term use damages the brain, liver, and kidneys, and may even cause dementia. Unlike other substances, inhalant withdrawal isn't well defined, but treatment focuses on stabilization, safety, and long-term social support. Next, opioids. These include natural forms like morphine and heroin, as well as synthetics like fentanyl and methadone. Opioids act on mu receptors, producing pain relief, euphoria, and unfortunately, high potential for dependence. Heroin is the most commonly abused opioid, with men more often affected than women. The hallmark signs of intoxication are pinpoint pupils, sedation, and slowed breathing. In severe cases, respiratory depression and coma occur. This is the classic opioid overdose. Withdrawal, on the other hand, isn't usually fatal but is extremely uncomfortable, with symptoms like muscle aches, diarrhea, sweating, runny nose, and insomnia. Overdose is treated with naloxone, a fast-acting antidote, while long-term treatment may include methadone, buprenorphine, or naltrexone, combined with therapy and peer support. Finally, sedatives and anxiolytics, which include benzodiazepines and barbiturates. Benzodiazepines like Valium and Xanax are widely prescribed for anxiety and sleep problems, but they carry risk of misuse. Barbiturates, once common, are now less used due to their high lethality. Both enhance GABA activity in the brain, producing sedation. Intoxication looks much like alcohol: slurred speech, poor coordination, mood swings, and in high doses, stupor or coma. Withdrawal is the real danger. It can be fatal, with seizures, hallucinations, and severe agitation. Benzodiazepine withdrawal seizures typically occur around day 2 or 3, while barbiturate withdrawal can be even harsher. Treatment involves careful tapering, often with long-acting substitutes, plus supportive care. So, to wrap up, hallucinogens can distort reality and trigger lasting perceptual changes. Inhalants are dangerous, especially among teens, and can cause sudden death. Opioids remain one of the most lethal categories due to overdose risk. And sedatives, while medically useful, can lead to dependence and life-threatening withdrawal. Each requires not only medical management, but also compassion, support, and long-term strategies for recovery. That's it for today's session on Part 3 of Substance Use Disorders. Thanks for listening. And remember, understanding how these substances work is key to reducing stigma and improving care. If this review helped simplify a difficult topic, consider subscribing for more high-yield medical education content. And let me know in the comments what topic you'd like covered next. Until next time, keep learning, keep growing, and keep expanding your horizons.